And now, let's hear from Suzanne Faith of Cape Cod Healthcare. Suzanne has written an insightful article in this edition discussing the critical importance of adult daycare and respite services. Welcome, Suzanne.
Well, thank you. I'm happy to be here.
Well, thank you for joining us. So, Suzanne and I met at the Dennis Senior Center, where she hosts a
bi-monthly caregiver support group
yeah.
for those caring for somebody with dementia or Alzheimer's disease.
Yes, so that's kind of where Suzanne and I know one another from. But before we get into that, let's start a little bit about you, Suzanne.
Well, I'm a psychiatric nurse, dementia professional, practicing for 40 years, mostly on Cape Cod. And I didn't start my career thinking I was going to be a dementia specialist, but I fell into the job initially in a long-term care facility and on a dementia unit. And I really enjoyed it. And from there, I began working in the community and developed a number of programs for the community and really discovered that caregivers need a lot of information that is not readily available to them.
Yes, absolutely. As a caregiver myself, sometimes I feel, completely alone or out there, and you don't know what's going on, or especially with some cognitive changes that may be happening.
Well, there's a number of different forms of dementia, and a lot of people initially will ask, well, what is the difference between dementia and Alzheimer's disease?
Right, because everybody, I think, just thinks, oh, Alzheimer's, and that's it. They're not really...
Correct. And dementia is a category. Dementia, we describe it as an umbrella term. And it's a category, and under the category of dementia, I know of 80, but there's probably more diseases that fall under that category of interfering with cognition enough that someone cannot perform the daily tasks of life.
That's very interesting. So when you say umbrella, so for people at home who may be watching, it's almost like how cancer would be an umbrella, and then there would be multiple different cancers underneath for people who are trying to maybe understand what,
Sure. I think rather than cancer, I would say when I describe it to a lay person, I normally will say it's like an infection. You come to me and you say you have an infection, and I say, okay, where is your infection and what is the cause? So in the same way, someone says they have dementia. Well, we know it's occurring in the brain, but different areas of the brain dictate different dementias. And that, interestingly, the reason I didn't want to go with the cancer as an analogy is because dementia does not metastasize through the body. Dementia, the brain is a closed system, so dementia stays within the brain, but the disease may start in one part of the brain, which will determine how the behaviors are initially manifesting themselves, and then it moves through the brain, ultimately taking over the entirety of the brain.
So fascinating. So because there's so many different kinds of dementias, people can be presenting in all different manners. And I think that's what can be a difficult aspect for caregivers too, because it may not just be, what people may typically think of as a symptom they might identify.
Well, and that's true, because most people will think of dementia as someone with short-term memory loss. And, the common things people will say are, they can remember all the details about their past life, but they can't remember what they had for breakfast. And that's true, but there are other forms of dementia, for instance, frontal lobe dementia or Lewy body dementia, which is more of a Parkinsonian type dementia. And in those situations, they don't have short-term memory loss initially presenting, but they might have a behavior that's presenting. And so the caregiver or the spouse doesn't initially think, oh, I think you have dementia, let's go get you diagnosed. They think, I don't know what's wrong with you, but something is not right.
Right.
And the other thing I just thought of, which is very common, is that for many people, they initially present with depression.
Interesting.
And it's a pseudo-depression. So it looks as if they're depressed and they act as if they're depressed, but in actuality, when they do a memory screen or they have a CAT scan and a memory screen, it turns out that it's not depression at all. And certainly the physician or the neurologist might try them on an antidepressant, but if they recover, then truly that was a depression. If they don't recover, then they're looking at what kind of dementia may be occurring in that person.
Absolutely. And would you say that a lot of people may think that this is something that only affects older people, but that's not really true?
That isn't true. And there are, with Alzheimer's alone,
right,
there's the young onset, which
right,
is anybody diagnosed before age 65. And actually, unfortunately, we're seeing more of that. And then the age-related
right.
Alzheimer's. So again, anybody diagnosed after age 65.
So in your realm with Cape Cod Healthcare in neurology, how do you guys begin, assessing or?
So our program is, the formal name is the Dementia and Alzheimer's Caregiver Support Program. And we're a free service to anybody in the community that is a caregiver of someone with a diagnosis of dementia. You have to be the healthcare proxy of that individual, but that really, beyond the diagnosis and beyond being the healthcare proxy, those are the only two criteria we need, and you just make a phone call to our office. So there's a couple of points of entry for us. One, if you make a phone call and you say, I'm a caregiver, I'm dealing with this, I just don't know what to do, I don't know what I need to get organized, you can enter that way. If you go to the emergency room or you're admitted inpatient and you're discharged back to the community, it is now Department of Public Health law in Massachusetts that you are required to have a referral to a dementia care organization in the community. So we get all the referrals from the hospital. And
interesting.
The third pathway, which is probably people would think the most logical, is the neurologist will see you, and then the neurologist gives us the referral, and we're now in the same building on Route 132 across from Toyota. That's the easiest landmark. And you'll see the sign for the Neuroscience Institute, and we're located there. And so those are the 3 points
right.
of entry.
So if somebody is watching this at home and they think that they're thinking this about themselves, or they're a caregiver and they think, well, I don't even have that dementia diagnosis yet, where does that process begin? Can they, with the primary care?
Yeah.
Or?
So for most people, their initial diagnosis is they have a discussion with their primary care, and that can generally happen one of two ways. Often people who are having the problem are unaware that they have the problem because you can't remember what you don't remember. If someone is pointing that out to you, you think they're trying to manipulate you or play a trick on you. So it's usually a family member that will contact the doctor and say there's something going on with my parent or my spouse. And so part of Medicare annual medical visit is that you can have the doctor do a baseline mini mental test. And if there's discrepancies there or they're unsure of that, the primary care will give a referral either to the psychologist at Lewis Bay, or they may just go ahead and do a CAT scan or an MRI.
Yeah, I think that's something very important that you point out, is that it can be part of that annual exam. Yes. And, you know, a lot of people that I talk to, caregivers in my line of work, they may just be starting out in their caregiving journey and may be a little uncomfortable with how to approach these sort of subjects. So I think that that's a really good little piece to know, is maybe when you guys arrive to the yearly physical, we can pull the primary aside and say, could we, conduct this little mini mental assessment where it's not being seen that you're taking over and,
Exactly. And, if the individual is early on in the disease process, they may do quite well on it. But it's important to have a baseline year to year anyway, because down the road, a year from now, when you go back for your annual physical and you do your memory screen at your primary care's office, it's often then that the primary care might notice, there is a change and something is going on. We don't want to wait until somebody is scoring fairly low, because the components of the care plan, which is what we work with caregivers on, really needs to occur as soon as possible.
Right. Now, speaking of care plan, you did give me a copy of this care plan that you've come up with. So I did want to talk a little bit about that. So if you could just, for people watching at home, kind of go over that.
Well, so if you were to call our office, or if your physician referred you to us or the hospital, as I said, any point of entry, we will bring you in for a 90-minute free care planning session. And during that time, we have a checklist, and that's the checklist that you have in front of you. And so the first thing that we want to make sure of is that you really go to see an elder law attorney. And people will often say, well, I have my own family attorney. And we say, well, that's good, but just, it's important to at least have a consult with an elder law attorney. If you were having any other kind of physical health problem, you would see a specialist. Right. So in this realm, you would also go see an elder law attorney, which really specializes in Medicaid estate planning. And so what we really want to find out are a couple of things. What is the budget for care? Because we know, even though that person may not need care right at the moment, as the disease progresses, care is going to be needed. And is it affordable for you as a family to be able to bring care into the home, or be able to have your family member live in a memory care assisted living, or will you need nursing home care?
And, I think that these are sometimes can be very uncomfortable subjects. Yeah. And I like that you've kind of laid it out, because sometimes you might not even be thinking of this. I know in my personal experience, when I first moved in with my grandparents, to be their caretaker, was not even on my radar of, budget or monetary. You're just like, I'm here to help. And then, as time progresses and you may not be able to work, it comes up. Well, you know,
it does come up.
And then you're kind of on your own trying to figure out what resources are available, or is this normal? What are other people doing? I feel uncomfortable because it's not about money, but
it is about money.
You know, you have to have a way to live. So I think that this kind of streamlines it a little and takes away some of that uncomfortability.
Well, you know, as we talked about with the analogy of, you know, dementia and infection, I use the analogy with this is that, you know, any plan that you have in life requires a budget. And that's no different than having a disease that will progress in life. And so it's not only the financial budget that you're working out with the attorney with, but you're also looking at, you know, who are the healthcare proxies? Because oftentimes if it's a spouse, the spouse with dementia is a healthcare proxy for the other spouse. And that needs to be taken care of before the individual is unable to sign documents any longer because they don't recognize what it is that they're signing.
Right. And, you know, God forbid there was somebody who was in the hospital or there's an emergency or something. It's much harder to expedite any sort of these processes once something like that happens versus getting ahead of it. Yeah. So I think this is great to bring to people's attention.
Yeah. And if you wait and you go for guardianship or conservatorship, that is actually a very difficult process to accomplish. It's very expensive and it's done in the court. So if you're proactive, which we're helping our families you know, be exposed to, then we can get a lot of this done early on and make sure that the path is cleared for the more difficult job of actual physical caregiving down the road.
So once you meet with the caregivers and you kind of get going on this list, what are some next steps that happen?
Well, so we give them the list. We check the boxes off as we discuss them in the meeting, or we give them homework. And then what we like to do is once the care planning session is complete, then we move that family member in or friend, as long as they're the healthcare proxy, we move them into a support group. Because in our support groups, we really seek to educate the caregiver. And a lot of people will say, I don't want to go to a support group because they imagine all kinds of things that, like, people are sitting around crying about their circumstance. And certainly there are moments that can be tearful, but that's not the point of being in a support group. The point of being in a support group is to be with other people who are on the same journey, sharing ideas of what they did to accomplish a goal.
Right, and little tips.
Yeah.
These things can be overwhelming.
You know, the whole driving issue, which we didn't even discuss yet, and probably not for this show, but that is something that we talk a lot about in group. And, you know, with each group, I have people that have been at, we have groups in Dennis, at the Dennis Senior Center, at our office in Hyannis, at Mashpee, we have Plymouth, we have Falmouth, we have Sandwich. So, you know, there's a place for everybody to go to, and no one will be turned away. But we really do want people to know that there's help there, and there are strategies to accomplish the most difficult things.
Yes, and you're not in this alone.
No, you're not alone.
So if somebody's watching at home and they think, okay, today it's a new year, I gotta start, I gotta tackle this. What can they do? Can they call? Can they?
Well, if they have a diagnosis,
Yep.
all they need to do is call us.
Okay.
And I think the number will be flashed
Yes,
on.
absolutely.
And we'll bring you in, and depending on, I work with 2 other nurses, so we have a medical model. Our program is a medical model where we do care management. We have the 3 nurses, myself and the other 2 nurses. We have an extensive background in understanding, physiology and all the other things that can occur on top of dementia. And we also are looking at the health of the caregiver.
Absolutely.
If you have a frail elder, caring for a frail elder, how successful is that going to be? So again, one of the things we do in the care planning session is we look at, what is your emergency plan? So that is something else that is, each one of these topics can be an entire conversation.
Oh yeah, an entire month.
Yeah, year. And so we really, we want people with dementia to get good care, and we want people that are providing that care to feel supported, and so they can call us at any time in the course of the caregiving to get support along the way.
Yeah, well, I think this is great. I think you've been really a wealth of knowledge and such a a resource for individuals
Sure.
out there. And I really do appreciate you taking time out of your busy schedule to inform us all. Even me, I'm like, I got to get going on this care plan.
Yeah, everyone does. I mean, we all need it. Yeah.
Well, I thank you very much. And I didn't know
Thank
if there
you.
was anything else that you wanted to share.
No, I don't think so. Everyone has their own unique path in this journey, but I would encourage the audience to call. And usually around the holidays we're really slow, but this year we had so many people calling, and it's never too early to start.
And it's never too late. So if you're feeling like, oh, I'm overwhelmed, or I dropped the ball, you didn't.
Yeah.
Well, I really appreciate you.
Thank you.
Thank you. And we hope that everybody found this informative. So thank you very much.
Thank you.